Case study for RN students. A 64-year-old male with a history of hypertension and coronary artery disease arrives at the emergency department complaining of shortness of breath and swelling in both ankles for the past 2 weeks. He states, "I can barely make it up the stairs." His current medications include lisinopril 20 milligrams a day and furosemide 20 milligrams PRN, which he admits he hasn't taken regularly because it makes me pee all day. On assessment, his vital signs are BP 162/94, HR 108 BPM, RR 26, temp 98.3 degree, and 92% on room air. Exam reveals crackles in the bases, bilateral 3 plus pitting edema, and JVD. His weight has increased by 8 pounds in the last 10 days. ECG shows sinus tachycardia. BNP level is elevated at 2950, and his chest x-ray reveals pulmonary congestion. The provider diagnoses him with acute decompensated heart failure. The RN places James on nasal cannula, monitors his vitals, and inserts a Foley for accurate urine output. An IV is started, and furosemide 40 mg is administered. The nurse monitors intake and output closely and assesses for signs of worsening respiratory distress. Patient asks, "Am I going to be stuck like this forever?" The RN uses therapeutic communication to explain the nature of heart failure, emphasizing that while it's a chronic condition, symptoms can be managed through consistent medication use, sodium restriction, fluid balance, and daily weight monitoring. Before discharge, the RN collaborates with the dietitian and pharmacist to provide education on low-sodium meal planning and medication adherence. The nurse reinforces the importance of recognizing early signs of fluid overload and when to seek medical attention. 1. What are the nursing priorities during James's acute episode? 2. How does noncompliance with diuretic therapy contribute to his symptoms? 3. Which nursing interventions prevent complications in acute heart failure? 4. What discharge education is essential to reduce readmission risk? For RNs, this case emphasizes comprehensive assessment, fluid management, and patient education in chronic cardiac conditions. Early recognition of decompensation, medication adherence, and interdisciplinary collaboration are key to preventing exacerbations and improving quality of life. Explore case studies like this one at nurselearn.co.